रेडियो नशा।
Hi, मैं हूँ रंगीली रुचि on Radio Nasha and we are back with one of the most loved segments on our channel which is Ask Me Anything with Dr. Munjal. डॉक्टर मुंजाल जिन्हें एक इंट्रोडक्शन का जरूरत अब नहीं है हमारे शो पर हमारे चैनल पर स्पेशली बिकॉज यू हैव बीन अ co-host on my show for now the past few months.
Not a co-host, but a very, very happy guest.
Oh, I'm so happy. I'm happier about that. But of course, Dr. Munjal is a senior gynecologist, obstetrician, but along with that, he's also the director of Namaha Healthcare. So, welcome back to the show and your own segment, Ask Me Anything.
Always happy to be here, Jay.
So, Tanya has a question जो हर एक न्यू मॉम के दिमाग में होता ही है उनको लग रहा है कि ब्रेस्ट फीडिंग करते हुए उनका मिल्क सप्लाई इज नॉट इनफ सो शी वांट्स टू नो द नेचुरल वेज जिससे कि मिल्क सप्लाई बढ़ाया जा सके.
When you've had a good amount of supply and say suddenly कम हो गया है, it could be 2 or 3 reasons. One is कि baby की demand बढ़ रही है and your body is not being able to keep up with it. The other could be that your fluid intake has gone down.
Okay.
Your calorie intake has gone down, your protein intake. So make sure your nutrition is well looked after.
Yeah, the body asks for it. When you're breastfeeding, you just
Yeah.
feel like pani, pani.
Yes, because if you are dehydrated, you are not going to make
Yeah,
adequate milk.
yeah.
So first correct all of this. Beyond that, there are a lot of these natural things available in the market with shatavari and this powder and that powder, and even sometimes things called delivery mukhwas and some capsules which have all these Ayurvedic preparations in it. Unfortunately, no studies have actually shown कि भाई because of this milk बढ़ेगा. और most of the time logic is कि सब कुछ कर दो, सब कुछ दे दो, जो भी लग गया तुक्का लग गया type situation.
कोई ऐसी चीज है क्या जो कि ये कम कर सकता है? Has that been proven?
Yes, breast milk कम कर
Yeah.
सकता है. Very often we see when mothers are keeping slightly poorer health. Suppose the delivery was slightly more traumatic. Suppose the baby has some other issue. Sometimes some babies are born with a little bit of a heart ailment, or they develop jaundice later, or they develop
So that's
some
stress.
that's stress, and sometimes even domestic stress at home.
But any kind of food habits or
No, certain medications, if you are taking, you have to check with your doctor whether you can
Alright.
take it or not. So, if you've had heavy bleeding and suddenly you started birth control pills, or you started some hormonal medication, those can suppress breast milk. So,
Alright.
वो एक बार देख लेना है कि वो सब you are not inadvertently taking something that may cause you to have a dip. So, meet your doctor. But another thing is that most mothers I've seen now, they put too much pressure on themselves. They are, if it goes down, instead of trying to become calmer, it worsens their anxiety,
I
which is
agree.
understandable.
I
So you
so
need to
agree.
go to a pediatrician or a gynecologist who is a little more calmer with you, will understand you, will say कि नहीं होगा तो भी we have other ways to make sure your
Yeah.
baby doesn't go hungry.
yeah.
That is the key. The fear is that, and the mother needs to be told that this is not her only duty in the world. She's not Mother Dairy. हाँ, मतलब this is not what she has been brought to this earth for. कि भाई one thing I was supposed to do, breastfeed my baby on a हो पा रहा है तब तक ठीक है, नहीं हो पा रहा है तो we will help you out. You have not failed as a woman, failed as a mother, failed as some.
You know, now I can laugh over this, but I do remember that I was feeling exactly the same thing. जब मैं इससे ही गुजर रही थी और शुरुआत के शायद 10 दिन रहे होंगे जब ऐसा हुआ because again traumatic था मेरे लिए समय. और उसके बाद I had an oversupply and I had freezers and I had to buy an entire new fridge. It was like that.
So you know, many patients, and I'm sure some of your listeners will also respond to a more personal story.
जी.
We have 2 kids, my wife and I. My elder one is a daughter, and my younger one is a son. The elder one has never touched a bottle in her life.
अच्छा.
She went straight from nursing to drinking from a glass on the dining table.
Wow.
At that time, I was flying. I was a young doctor. I said, no, you have to work. हाँ,
Example
मैंने
है
तो
ना?
कुछ किया नहीं ना. Everything was done by my wife. So didn't hurt me talking. No, you must. You have to try. You can't give up. 1.5 years later, nearly 2 years later, I had my son. There was no supply only.
Yeah.
I had to swallow my pride. I used to get so agitated. I used to take it out on her, on my wife. Like, why is it not? Why is it? She's like, instead of being supportive, you are actually like trying to make it seem as if it's my fault. So that rewiring of the brain has happened over years,
Yeah.
and that made me understand कि भाई नहीं हो रहा है तो
Yeah.
don't burden the mother more. Instead, try to find ways to help.
Yeah.
Supplement. So we supplemented, and actually there was no difference between my daughter and my son. So now I know that what does stopping of the breastfeeding will not do as much harm as everybody else trying to pressurize her into
I
breastfeeding.
so agree. This is so important. I'm going to repeat this answer quite a few times on the show, actually. It is so important.
So, to anybody listening, if you're getting great breast milk, if it's all happening, it's amazing. It's the most convenient, safest, most efficient way to feed your child. There's no need of any bottle, any warmer, any. If possible, your child should never touch a bottle.
सही बात है.
But if you're not getting it, I don't want you to kill yourself over it. I don't want you to live the rest of your life thinking you're some sort of a failure because you're not.
Yeah. वाओ, बहुत नीडेड था ये एक सेशन और लेसन. पल्लवी सेज पीसीओडी और पीसीओएस में क्या डिफरेंस है और क्या दोनों का ट्रीटमेंट अलग होता है ना. दिस इज लाइक वी आर टेकिंग योर एग्जाम आल्सो.
हाँ.
ओके, 5 marks question.
5. Bapre. So, this is the most commonly asked question to me in my cabin by anybody in their 20s. Doctor, do I have PCOS or PCOD? And I tell them that this is rubbish. You are not supposed to label it like that. PCOD is the old name for the same thing.
अच्छा.
PCOS is the new name for the same thing.
What are you
There are
saying?
still online resources which still try to distinguish PCOD and PCOS, and it's stupid.
What are you saying? I do remember somebody someday telling me, and this is somebody from the medical profession, कि अभी ये PCOD
S होने लगा है.
हाँ.
और D, I'll tell you the reason for
PCOS
it.
हो जाएगा अगर नहीं कंट्रोल किया.
First, it used to be called polycystic ovarian disease,
हाँ
but it's not a disease.
हाँ
The
कर.
नाम change करके polycystic ovarian disorder हो गया.
Okay.
Now it's not a disorder. The thing with any disease or disorder is that भाई एक चीज होनी चाहिए. I have a migraine. I have a cataract. Polycystic ovaries can present in so many different ways. Either with period irregularity, very heavy, very scanty, too frequent, too infrequent. हर एक चीज हो सकती है उसमें. Weight gain भी हो सकता है. You can have very thin PCO also.
अच्छा.
You can get acne also. You can get increased facial hair also. You can get skin pigmentation also. Or you can get perfectly regular periods with only one something else. You can have unexplained weight gain. There are so many things of which you can have all or none or one. Whenever there is any symptom complex, जहाँ पूरा बुफे है, उसमें आपको सब कुछ भी मिल सकता है, कुछ भी हो सकता है या कुछ भी नहीं, that's called a syndrome. And hence polycystic ovarian syndrome is the new and correct terminology for it.
ऐसा भी कोई सिंड्रोम होना चाहिए जिससे हमारी स्किन के एक्ने कम हो जाए और फेशियल हेयर कम हो जाए. I so wish.
Yes.
But hormonal pills, I think, did help me. So, do you think that it does help with this?
For girls with polycystic ovaries, definitely. Especially if with polycystic ovaries, if you have slightly elevated androgens, the male version of the hormone, which is often found elevated in girls with PCO, certain birth control pills, they're not given for birth control exclusively, but they're designed for girls with PCO.
Okay.
So they bring down your androgen levels. They bring down your water retention. So if you take those pills and you have PCO with high androgens, then it'll work.
Yeah. So if it did work for me, इसका मतलब
था आपको.
चलिए इसके बाद में मेरा एक कंसल्टेशन करेंगे. Okay. अंकिता बहुत ही.
At this rate, you are only going to start consulting in 1-2 months. I will not have to sit here. She will only be giving the answers.
Yeah.
She's become half a gynac already.
And I've been interested to become one, so yes. But अंकिता कह रही है प्रेगनेंसी के टाइम पर एयर ट्रैवल करना सेफ होता है या इसे अवॉइड करना चाहिए?
Absolutely safe.
Okay.
It's the safest way to travel. I mean, I'm assuming this means commercial air travel in a pressurized,
Of course.
proper
Yeah.
aircraft and not
Yeah.
some random. So absolutely safe. You can.
मतलब ऐसा पैराशूट से नहीं खुद ही लगा रहे.
Means I'm assuming it's just regular air
एयर
travel.
ट्रैवल करना है चलो.
So people are very worried about this.
Yeah.
They're like, नहीं doc वो pressure changes हो. I'm like होना ही चाहिए. Means you're in a pressurized aircraft. The pressure is going to change in the atmosphere, but in the aircraft pressure doesn't change. If suppose cabin gets depressurized, then everybody is screwed.
But वो टेक ऑफ के समय या लैंडिंग के समय वो एकदम से जो वो खिंचता है,
हाँ.
maybe that is something. So
Nothing.
when I was pregnant, of course I was worried about that. कि
Nothing.
nothing.
Absolutely safe.
Overthinking.
No, I mean, people think that acceleration is some ridiculous level of acceleration. You are not in a fighter jet. I mean, a fighter jet would also be safe.
Okay.
Sometimes some people drive worse than pilots take off.
That's true.
हाँ, and लैंडिंग का जो झटका है उससे ज्यादा तो रिक्शा में मिल जाता है
वो तो
झटका.
है, वो
So
तो
then
बिल्कुल
how
सही
does it
बात है.
matter? It's absolutely safe. The only time where I would avoid, I would suggest a little bit of caution is if you're a very, very high risk pregnancy.
Yeah.
Say you have a low lying placenta where the chance of you bleeding when you're at an airport on a flight where nobody knows what to do is there, or you know, flying very, very close to your due
Delivery
date.
yeah.
तो वो ठीक है मतलब but for majority of the people they will fly for a baby moon like between the 3rd month and the 7th month go do a couple of baby moons if your doctor I mean tells you that you're safe and your pregnancy is not too complicated it's safe to fly the actual act of flying will do nothing to your pregnancy or the baby you can even go through the metal detectors people are like no I'm pregnant I'll go from the side
हाँ yeah.
तो कुछ नहीं है it's not radiation I mean
हम
if
बच्चों
it-
को तो अभी भी नहीं करवाने देते हैं. We
but
ask them to
it's silly,
just.
no? It's just like a magnet. You're wearing an Apple Watch with magnets. You're, closing your things with
But
magnets.
you know, this is something that even those security guards they also follow. So they will not put that rod thing on
Because they're scared.
while
No,
they're doing this.
nobody.
Nobody knows. We are just following something.
Yeah, people are just randomly following it. Nothing happens when you beep that wand in front of the belly. What will happen? Like,
Wow.
but क्या होगा? It's not radiation. Suppose it is actually radiation. तो हमें नहीं जीना है क्या? Like the radiation will affect
या हम
non-pregnant
वो
people
जो
also ना.
बैग स्कैन मशीन उसके अंदर नहीं जा रहे.
That's my point. That is
Imagine.
exactly my point. So,
Oh
yeah.
my God.
So don't fight at an airport if you're abroad somewhere and they're like, I'm sorry, this is safe. And you beep, beep, like, no, something happened. Don't become a Karen. Just say, yeah, beep all you want, nothing will happen.
The next two questions are fertility related. Skin care medicines ऐसी कुछ होती हैं ointments या even oral जो कि आपके pregnancy को affect कर सकती हैं. Is glutathione one of them?
So we don't recommend you taking glutathione just around your pregnancy time or even when you're pregnant. But more than even glutathione, a lot of patients for acne, etc., take isotretinoin.
Yeah.
Okay, that's a vitamin A
Derivative.
derivative. So those are the pills that cause toxicity to the developing embryo. So if you are taking oral isotretinoin, that needs to be stopped at least 3 to few months before your, I would say 3 months at least before your pregnancy, before you start trying for your pregnancy.
Okay.
So beyond that, talk to your skin doctor and say most skin doctors are that way quite conservative. When you say I'm going to try for a baby, they'll immediately withdraw anything that is like borderline also.
Yeah.
So that way they're quite competent enough to say, I'll manage it some other way. Right now, you're not going to shoot a film or a show or something like that. You want to consider, I'll manage it in another way. Stop all of this.
Yeah.
That's fair.
Yeah. Not to promote a brand actually, but I remember that time when I was pregnant, I was only allowed to use Borolene all throughout.
I mean, that's a little extreme, but fair enough. I mean, there are so many safe products. It's not that, but
But
Borolene
it's
is the
just that
OG,
bachpan
na?
wali thing,
Ah,
na?
OG,
Yeah. Okay.
Sometimes
Naina
not
ka-
using anything at all may give you the best skin.
yeah.
Like my wife hates it. I'm a 1 bar of soap guy.
Yeah.
So I shampoo every day, which she hates, saying that you'll ruin your hair. I've been shampooing every day since I was a kid, and I've been using the same bar of soap. I mean, it's not a fancy bar of soap, but that's all I use. I don't use any fancy shower gels and this and that. And actually, like, how? Your skin
Because
requires.
you've cracked the hormone code.
Your skin requires a different this formulation. Your hands
AMPM.
require different formulation. I'm like, I don't have time for this.
Oh God.
I take the bar of soap and that's it.
Oh God. Yes. Okay. Another
I'm
question.
not going to get sponsored by any skincare company now. Like, no point in spending,
No, or maybe you will.
spending
because
any money on him. He's
they'll
not going
come
to
and
use
they'll
it.
say, we are that one shampoo
We
that
are
you've
that
been
one,
using.
yeah.
Yeah. नैना कह रही है कि स्लीप साइकिल अगर इरेगुलर हो तो क्या उससे भी फर्टिलिटी इश्यूज हो सकते हैं?
Definitely. A good night's sleep and proper night's sleep at the proper time is very, very important for your circulating hormones. So a lot of people don't understand the importance of going to sleep on time and not watching shows late into the night or being on your phone or social media late into the night and then having to wake up in time for work and not being well rested. Sleep is very, very important. So in your 20s you can get away with a lot. So even as medical students we barely got any sleep. Like we used to sleep at 3-4 o'clock, get up at 6, go for rounds, kahin kabhi so liya. It's not a healthy way to live. So not only will it affect your reproductive potential, It will also affect your unnecessary weight gain, bad cholesterol, everything will worsen. So if you can get some amount of sleep hygiene in, where you say put away your screens about 10:30 or so and say, okay, I'm not going to doom scroll. Endless reel. There's no funny reel that you're going to miss out on if you go to sleep on time. You wake up at a reasonable hour, like 6 or 7 o'clock. Give yourself enough time to eat something healthy, get dressed and go to work. Dramatic difference over time.
Okay. Thyroid issues से fertility और pregnancy कितना affect हो सकती है? That's what Rashmi wants to know.
Quite a lot. So thyroid is a very, very vital hormone, not only in pregnancy and beyond, and even when you're trying for pregnancy, but even otherwise for your life.
Okay.
So the thyroid hormone is required for probably every function of the body.
अच्छा, that important.
That important. And most of the times you get diagnosed with thyroid only when you're pregnant. Once you get pregnant, they do a blood test, उसमें आ जाता है you're borderline hypothyroid. When you start the medicines, patients will be like, अरे डॉक्टर मुझे नहीं चालू करना है because once I start, I have always heard lifelong लेना पड़ेगा. Like I don't want to be lifelong on medicine. And like, would you rather be lifelong deficient in thyroxine? It's like me saying to my eye doctor, कि no, I don't want to wear specs because once I wear specs,
जिंदगी भर पहनना
जिंदगी
है।
भर पहनना पड़ेगा. तो my opthal will tell me ना कि are you
तो पर दिख तो नहीं रहा है तुम्हें।
are you mad? Like, are you stupid? Like, you wear your specs for 3 months and your eyes will become magically okay? No, my eyes are weak, so I'm supplementing them with this. Your thyroid is weak, so you supplement it with a pill. Say you are no longer pregnant anymore, you're not trying, you've worked out, you've got your life under control, you've lost dramatic amounts of weight, your requirement may go down. So there is a chance that शायद नहीं भी करना
बंद भी
पड़े.
हो जाए।
But is there some natural way कि मैं ऐसे ही बस with my diet solve कर लूँ? Most of the times, no. That will also not work till you at least correct it with this. So yeah, very important.
जया wants to know breastfeeding के टाइम पर hair fall issues common है क्या और इसको कैसे मैनेज करें?
Very common. So it is not just about breastfeeding. So if you think कि exclusively खाली breastfeeding के बारे में, then make sure that your iron levels are okay, you are taking your calcium supplements properly, you are taking enough vitamin E, etc., etc. All that fine. But despite taking everything, the falling of hair is seasonal. You will have a year where you will shed like a Labrador,
Yeah.
like a golden retriever. There was a time in my house where I used to ask myself, what is happening?
Yeah.
It's every, but what happens is that it comes in waves. And very often, some girls lose a lot of hair during pregnancy to that point they say, Doc, what I see in the shower, I think I'm going to go bald.
Yeah.
Because there's no way I can lose this much hair and not go bald. My thing is, you're not going to go bald. And a lot of patients for 1 year after pregnancy will also keep shedding because it's that sudden drop in your pregnancy hormones which triggers this hair follicle ka, stoppage.
Very traumatic, but that whole period.
Yeah, I can imagine.
इतना बाल, and you do get some patches here and there जहाँ पे
It's thinning.
scanty लगने लगता है.
Like
Thinning.
you feel like I used to have, and you see some photos from 5 years ago where you were like bouncy hair.
Yeah.
And now it's flat hair. Yeah, it is a little unsettling, but it is normal.
Okay.
And it does tend to have like regrowth and you'll get your hair back. But will some amount of your body live with the scars of having born children? Yeah. And most patients proudly wear them.
Of course, that's what I was just going to say. Deepika कह रही है birth control pills से weight gain होता है क्या या सिर्फ एक myth है?
No, it's not a myth.
Oh really?
Yeah. So it depends what kind of birth control pill
I seriously thought you'll say, of course it's a myth.
No. The pills designed for girls with PCO, they're designed to prevent some amount of weight gain.
Okay.
However, the conventional birth control pills, जो normal खाली contraception के लिए देते हैं, the compounds which are there in that can cause a little bit of water retention and a slight amount of weight gain, but it's not like I've put on so much weight, it's only because of this. No. But say maybe a kilo or 2 kilos after a year of taking it. Also, if you are a slightly proactive kind of individual who will work out or eat healthy, you can easily counter it. So it's not like I'm going to take the birth control, means now I've become fat. No. Untrue. That kind of connection is untrue. But can it theoretically cause a little bit of weight gain? The answer is yes. So when you're being prescribed, talk to your doctor about it. Is there an alternative I could take instead of this? Can I take this which will not let me feel a little, thoda bahut, but your choice. Ask your doctor about it.
Okay. Ask him anything. Kajal says ovarian cysts उन्हें बार-बार आते रहते हैं. क्या reason हो सकता है? कैसे prevent किया जा सकता है?
So it depends. Now, this question I will take with a little bit of little bit defensively, saying कि कैसे type के cyst आ रहे हैं वापस. So that's my key. It's sometimes girls who are when they go for scan, then it comes as polycystic ovaries. They feel कि अरे यार cyst है. And then every time they go polycystic, अरे cyst है, ये बार-बार cyst आ रहे हैं. No, if it's only polycystic ovaries, it's always there and it's always going to be there. It's just the unruptured follicles that you are seeing in your ovary like that.
Right.
So if that is the condition, तो it's बार-बार आ नहीं रहे, वो है ही polycystic ovaries. They are not cysts. They are just your unruptured follicles. If you're getting one big cyst every like few months and you're getting some symptoms because of it and your doctor is saying, find out किस चीज का cyst है. Is it a simple cyst, खाली water fit? Is it a blood वाला cyst? Is it this? And each one has its own way of getting managed. So that's why very often people interchangeably use polycystic ovaries and this, because when they go with their moms, the doctor says, नहीं cyst दिख रहे हैं. Once that cyst comes in, they are like, अरे, I've taken that 3-month course of pills, तो भी नहीं गया, वापस आ गया, वो है ही, वो जाने नहीं वाले हैं.
ओके. एंडोमेट्रियोसिस के लिए क्या सर्जरी एक अकेला सोल्यूशन है या फिर कुछ लाइफस्टाइल चेंजेस से मैनेज कर सकते हैं? दिस इज व्हाट रेखा इज आस्किंग.
So one thing people have to understand, like a rule, that endometriosis is a surgical entity only. Surgery is the definitive treatment for endometriosis. However, surgery is not required for everybody because endometriosis के भी grades रहते हैं. If it is very mild to very severe, yes, once you cross that mild to moderate, तब you need to have a little bit of corrective surgery ताकि आपको symptoms ना हो, या if you are one of those lucky ones who have endometriosis without symptoms, ताकि progression ज़्यादा ना हो. Having said that, अगर mild stage पे diagnosed है वगैरह, तो there are certain medicines that you can take, certain regimens that you can be on, which slows down the progression or at least halts it for temporarily.
Okay.
Second thing is that after doing the surgery also, your doctor may put you on certain medication and this thing to prevent recurrence. So there is a dawai part which is important in endometriosis. But if you point blank ask me that what is the definitive this thing of endometriosis, the answer is surgery. Okay. That yes, if it is quite bad, then you cannot reverse it by saying I will stop smoking or whatever. You know, there are some studies that smoking is beneficial for endometriosis.
Yeah.
So you won't die from endometriosis, you'll die from lung cancer. Because,
That's so funny.
it is such a stupid study. There were many studies done saying that smoking prevents Parkinson's also. Smoking prevents irritable bowel syndrome. Smoking prevents endometriosis also. And later they found out it's because they didn't live only long enough for it to...
Correct.
So that way, you can't say that I'll stop drinking, I'll become clean in my habits, I won't party, I won't this, I'll sleep well. I mean, all that will improve your overall health, so you should do all of it. But will it reverse your endo? The answer is no.
But is there something जो किया जा सकता है to prevent it from happening?
No.
No, no. It's in your genes.
If you're going to get it, you're going to get it.
Okay. दिल से आपको thank you बोलना चाहती हूँ for all the help and for your advice, your medical help and everything else जो आप हमें help करते हैं in life. Thank you so much.
Most welcome. Thank you for having me.
Radio Nasha.